everyone. Thank you so much for taking time out of your day to join us for the NeedyMeds special topic webinar, RX Outreach, Making Medications Affordable. My name is Carla. I am the Director of Education and Partnerships at NeedyMeds. And before we kick off today's presentation, I want to go over just a few tips. You can feel free to ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the chance to answer your specific question, we will follow up with you personally via email. Of course, we'll provide the contact information for both NeedyMeds and RX Outreach at the end of the presentation. This webinar is being recorded, and we'll convert it into a video and post it to the NeedyMeds YouTube channel so that you can view it at a later time or share it. In the handouts section of your GoToWebinar control panel, you should see three attachments. Two of them are PowerPoint presentations, and one of them is an informational document about RX Outreach. If you have trouble accessing them, again, you can shoot me a message in that questions section, and I'd be happy to email them to you after the presentation, either later today or by tomorrow at the latest. So with that, let's go ahead and get started. For those of you that are not familiar with NeedyMeds, what you're looking at on your screen now is our updated mission statement and how we achieve that mission. NeedyMeds is a national nonprofit, and our goal is to connect people free and anonymously through our website and helpline to programs that will help them afford their healthcare expenses. And as you can see up there with that mission statement, a big part of our goal is to educate people. I always put a snapshot of the NeedyMeds homepage because really our website is the face of our organization. A couple of things I want to point out. In the top left-hand side under that patient savings tab where my mouse is circling, that's where you'll find most of our healthcare cost savings resources. The Advocates tab to the right of that is chock full of educational information. And the beginning of the presentation, I mentioned our YouTube channel. And you can find a hyperlink to that, the third icon from the left on the top right-hand side of our homepage with all of those social media icons. So as I said, a big portion of our mission is education. And we define education really in two ways. First, by letting people know about NeedyMeds or educating them about who we are and the resources we have to offer, but also by educating our users about other ways to save on their healthcare expenses and get access to the medications they need, which is why we are so pleased to have our guest panelist here with us today from RX Outreach. So RX Outreach, simply put, is a nonprofit pharmacy whose mission is to provide affordable medications. I put a screenshot of their website up there just so it looks familiar to you, and also so you can see how simple it really is to get assistance from them. So that's just a little bit about RX Outreach. Now let me tell you a little bit about our guest who's going to talk to you further about that. Joining us today is Pete Wyatt. Pete heads up the marketing and provider relations team for RX Outreach. His team's primary goal is to share resources and serve low-income patients and their providers, helping to ensure that those in need of affordable medication have access. So without further ado, and hopefully seamlessly, I'm going to go ahead and pass the mic and the screen to our panelist, Pete. So bear with us while we do that and while Pete grabs that screen. And as he does that, I'm going to remind everybody also that if you do have questions, you can go ahead and type them at any time while Pete is giving his presentation into that question section, and we'll do our best to get to those at the end. Pete, with that, I'm going to pass the screen and the mic to you, so go ahead and take it away. Thanks, everybody.
As always, thank you very much, Carla, and thank you, everybody out there listening, for taking the time to learn a little bit about us. I invite you now. Carla shared our just a picture of our homepage with you. I invite you now, if you have two screens or the capacity, to listen on your systems, however that is, just to visit our website now and take a look at our medications. We're gonna go over it at a 30,000 foot level because each of you listening has a different patient need, patient service structure. So what we want to do is provide an overview and allow for Q&A or even offline follow-up so that you can get more specific about the needs that you have, whether you are a provider, an advocate, or a patient. So with that, we'll get started. So again, RX Outreach, what we're going to cover today is what actually is RX Outreach. And we try to answer that because honestly, we are so simple to us that it's confusing to a lot of people because of what we are and what we don't require. We're going to talk about when to consider RX Outreach. And again, consider is a key word here because we know about the search for free, we know about the search for local, we know about the search for particular dosages. So we just need to start with consideration. And then we talk about why RX Outreach, and then we talk about just how simple it is to use RX Outreach. So what is RX Outreach? First and foremost, we are a national nonprofit mail order pharmacy. A lot of people out there may be saying, so how does that work? We spend a lot of time talking about that, but we are the largest, perhaps the only, national mail order pharmacy that is nonprofit that focuses entirely on low-income patients. We're missioned to work with the safety net providers to provide those in need affordable medication. We are not seeking to provide anybody a silver bullet in terms of we should be your only pharmacy. We are only looking to provide additional safety net services for those patients that fall through your net, that cannot match your formulary, that cannot get to a pharmacy, all of those kind of things. So we're kind of a special needs pharmacy for you. We serve all 50 states, Puerto Rico, and the Virgin Islands. We have more than 400 medications, most of them generic, with over 1,000 different strengths. We served last year more than 350,000 scripts. We do 9,000 prescriptions a week out of this facility. This is our only facility. And what's not up there is we take between 7,500 and 9,000 phone calls a week from people investigating our program, from our patients trying to get their medications changed, all of those things. And as a pharmacy, we have pharmacists on hand to consult, to advise, and to work with partner pharmacists or providers. We do not require a coupon. So we are not a middle person. We are the actual pharmacy. So if you're on our website or if you go to our website, what you see there are the prices you or your patients will pay. So we don't need a coupon, nor do we offer a discount card. However, our friends at NeedyMeds have a discount card that Carla's going to talk to you about a little bit. And being on this side, serving low-income patients, please pay particular attention to the distinction between this nonprofit generated card and the for-profit discount card. So you'll see that in a little bit. So when do you consider RX Outreach? If you are a provider, if you are a clinic, when you have exhausted all of the options for free medication, we understand that in serving this particular population, free is the magic word. We get that. We don't challenge that. We actually help patients find free. We help them, direct them back to NeedyMeds for their PAP information. But what happens in reality is that there's a cost to free. And the cost shows up with us in the fact that many of the providers who get free medications are writing their prescriptions to what they have, not necessarily what their patient needs. Prime example is we have a lot of people that might have a 10 milligram tablet of something on hand, but their patient may need 20 milligrams or 30 milligrams. We understand that the compliance conversation with a patient is far more effective if they have one pill to take a day versus 3. So that becomes a decision from a provider or a patient perspective as to, is free really free? Next is when the patient does not qualify for assistance, a PAP or Medicaid. We serve patients that America and the healthcare conversation does not believe exists. We serve a lot of people that don't have documentation. We serve a lot of people that don't have adequate documentation. We serve seniors who cannot find their Social Security information. So in all of these things, when a patient does not qualify for PAP or any kind of assistance program, we can help them, because all we require, moving on to that next phase, all that we require is the prescription. If the patient has no documentation whatsoever, we don't mind. All that we care about is you as a provider has identified that patient as someone that is low income and in need, and you are writing the script that comes to our offices. When the existing pharmacy relationship does not need or have the preferred strength, we kind of refer to this. If you have a dispensary or a pharmacy on hand, a lot of the providers we serve don't have 400 medications or 1,000 strengths. So when a pharmacy runs across the medication and they make the decision that getting the right dosage is better for the patient, we work hand in hand with pharmacies all across the country. The last big thing to consider is when the patient's compliance is threatened by mobility. We are mail order. Doesn't work for everybody. We understand that the patients we serve run a high risk of threat in a mailbox. We understand that not a lot of good things come from a mailbox. However, if you are a rural clinic, if you are a rural provider, if you are a telemedicine provider and you are not physically near your patients and they are transportation challenged, 40 minutes from your clinic, 50 miles from the city, not very mobile from the 3rd floor of a walk-up, mailbox is often a way to keep that patient compliant. So these are the big 5 or 6 things that we work with clinics, the majority of our clinics and provider partners across the country on. So again, we're not trying to be any one silver bullet. We don't think that's possible for any pharmacy. However, what we are is something unique in that we are low-income patient focused, and our entire systems are built for high-touch service. So if you are a patient or a caregiver, when do you consider RX outreach? The drawback on patient caregiver is, as with most mail order pharmacies, we cannot accept the we can't accept the prescription directly from you. It has to come from your provider, your doctor's office. However, as I stated in the previous slide, we are an extremely high touch pharmacy. So rather than being high tech, we would rather talk to our patients, and we take a lot of responsibility off their hands. So if you have a script for something, we will take that script and we will contact your doctor and have the doctor either resend the script or make that official, but we will do that so that the patient can be served. So on this slide, when does a patient or caregiver consider us? If for any reason you, the patient or a caregiver, is spending any of your money on medication, and the key here is any of your money. If a patient is paying a $20 copay on a 30-day medicine, but we have that same medicine for $22 for 90 days, there is a savings there that is real for that patient. So if the clinic, if the patient, if the provider, if the caregiver is spending any money on it, we may be able to help, because PAPs, standard pharmacies, hospitals issue 30-day scripts. We issue 90 and 180-day scripts. So there is real money to be saved long-term for patients. The next one is when you do not qualify for assistance. We went over that a little bit in the prior slide. We don't care if you are being assisted on any level. We only care to get you a medicine that you can afford and that's consistent and available for you. When you have no documentation, we covered that in the prior slide. We only need the prescription, your name, your address, and a payment. When you have more than one medication, this is critical for a lot of our clinic partners across the country. It is, for instance, we were in Florida last, I guess, a couple of weeks ago, and you have medications that are available. Actually, this happens in cities across the country. So you have a grocer that offers a medication for free, which is great. We send people to our local grocer all the time. However, if there is more than one medication, there is consideration that needs to be given. So I have a $4 med, I have a $7 med, I have a free med at the retailer, but I have another med that's $200. Yes, we may not be free for the first med, but we're not $200 for the second med. So those are the kind of things to be considered. And when we're dealing with this particular patient, if they choose to go to one store for one med and the other store for the other, you got to factor in time and cost into what you're actually saving. So we may be able to, in most situations we can, we may be able to send both of those medications, same quality, same strength, same manufacturer, to the patient's home or the clinic, saving transportation, saving scheduling, saving a lot of angst at the pharmacy counter. Finally, when the medication compliance is threatened by mobility, we talked about that. If you can't easily get to your clinic, your retail pharmacy, why not consider the same med, same service to be delivered to your home? So those are the kind of things that we do if you're a caregiver or patient. Those are when to consider us. So why? So again, when we opened this conversation, we talked about how we were the national, we're the largest. One of the unique things about us as a large pharmacy is that we are an actual large pharmacy with a lot of people that work here in a big space that controls a lot of stuff. But our difference is we are mission to focus on that patient. We're not interested in the adjudicated insurance claim. We're not interested in billing Medicaid. We're not interested in offering a low price to get them in so that they can buy chips and diapers and all of those other high margin items. We are focused totally on getting that patient the medication that they can actually use at a price that they can actually afford and with availability that is actually sustained. In that line, we are transparent. If any of you have gone online and you're looking at our pricing now, that price is what is paid, delivered to either your clinic or the patient. So there are no additional or hidden fees. There's no enrollment fee. There's no membership fee. There's no shipping fees, no standard shipping fees. If you request it to be overnighted, that is a fee. But what we understand is when someone has $20 and they have to spend 18 of it on medicine, they don't need to be final billed $30 because of a handling fee, a shipping fee, a membership fee. If you are a provider and you have one patient in the year that is going to fall through your safety net, that's fine. We don't need you to enroll. We don't need you to pay a fee. We need to serve that patient and keep them out of the emergency room. That's why we're here. We serve the uninsured, the underinsured, and the insured, the fully insured, we should say, with household incomes below 300% FPL. So most of the people we serve are under 200%. Most of our providers are under 250%. We have special consideration programs for people that are over 400%, but we serve them all. We do not care if you're insured, if you're uninsured. Again, if you're on Medicaid, we don't care. We only care that you can afford your medicines, that you can sustain that affordability, and that we keep you out of the emergency room, in your homes, on your jobs, to be able to take walks in the park. That's what we care about. We are a sustainable source for 90 and 180-day supplies of affordable medications. If you think about available medications as a continuum, on the left side of that continuum is free. Where can you get it free? That is important. In the middle of that continuum, there are people like Dispensary of Hope. There are people like RX Outreach. There are others out there, not necessarily on a national basis, that present it as affordable. We want to keep you out of the far right, which is retail. So one of the things that we do as a pharmacy is that we buy manufacturer direct. So we don't buy from wholesalers. We don't change our prices every week. We buy contracted amounts of medications so that when your patient is on amlodipine and needs amlodipine, it's in our warehouse. We have it on hand and can get it to them in 4 to 6 days. So we know that, and we are sustainable. So because we buy contracted lots, this is not something like free that we have now until November, and we're not going to have it. We understand that the lifestyles our patients live are fragile. We understand that when their medicine goes away, their lifestyles, their lives begin to spiral out of control. So we want to be sustainable, which is why we mandate that we buy. We do take manufacturer donations, but they are less than 15% of what we do every year. Finally, we are absolutely committed to this partnership with NeedyMeds and all of its constituents. We think NeedyMeds is critically important to educating people about us and other sources for free and affordable medications. So we are absolutely committed. So for all of those of you that are first-time NeedyMeds folks, know that you will continue to get good, solid information from them, and we depend on them to bridge us to you. So hopefully we can help you in doing what you do. So how to use us. This slide is changing as we speak. In 2019, we hope to eliminate the words patient must be enrolled, because the enrolled part is purely we need a name and an address to send it to. So somewhere along our history, we began calling it enrolling. But because we say the word enroll, it makes people think of membership. It makes people think of payment. It makes people think of spam emails and getting things in your mail. And that's not what we do. So to register a patient, or for a patient to begin service, a clinic can initiate the enrollment. The patient can initiate it online. It can be done in line. It can be done on the phone. I firmly understand how paperwork can frustrate people. But for those of you who currently use us versus those who don't, our paperwork compared to some of the other paperwork that you have to fill out for PAPs or government forms, you're going to love us. We require your name, we require your address, and that address is either the patient address or the clinic address, depending on where the medication is shipped. We need the prescription, which some of the forms out there, you can just write right into that. And then we need payment, and that's all we need. So we don't need your shoe size, how many grandkids you have, your income statements, your green cards. We don't need any of that. You can call us, you can go online and do it. You can send your stuff through the mail. My personal recommendation remains to give us a call, because our patient advocates will walk you through that enrollment process. We are working on a better online version, but to fill in online, you're still going to get a call to verify, so you might as well call and do it. The drama with that is in the last year, our volume has gone up significantly in call volume, which means our our call waits have increased, but we're addressing that. So again, to enroll or to begin service, all we need is the name, the address. We ask for the household income, but it's not something we keep. It's a trigger that says if you're under 300%, we keep talking to you. But if you're over 300%, we begin working with people like NeedyMeds to help you find the right place. You can submit prescriptions by faxing, by e-prescribing, or by mail. We are not a walk-up facility, so they cannot be hand-delivered. We have that. We have knocks on our door all the time. Medication is shipped when payment is received. So when we are asked how long it takes, we carefully say it takes 4 to 6 days, depending on what part of the country you're in, from payment. And why that's important is because again, we know who we serve, and we know that serving them is not a standard practice. We will get a name, we will get an address, we will get a script from the provider, but payment is often the patient responsibility. So we will hold that account open until payment is received. We've gone as long as 90 days waiting on payment, but we don't wait without reaching out. We try to reach the patient, we try to reach the physician to make sure that everybody still remembers we've got a script here that needs payment before we can ship it. Refill and prescription renewal reminders are sent directly to the patient. That is our way of removing work from the provider. We've got several thousands of these that we send out every week, and we follow up on them all one way or the other. So that's the overview. And again, when we started, I spoke of, each of you may have a very unique situation as to how you see patients, how you advocate for patients, how you refer patients, how you care for patients. The contact information that you have up there, we answer a lot of questions after these. So either one of us can answer. I will tell you confidently, and as a matter of fact, that Erica and Susan know way more about how this thing works than I do. But I'll give it a shot if you reach out to me. So with that, I turn it over back over to Carla for Q&A. And thank you guys for listening, and I hope that piques some interest.
Pete, thank you so much, of course, for that expert explanation of RX outreach, and it gives our users a sense of really not only what RX outreach is, but how you're able to easily and simply connect RX outreach users with the medications they need. I'm going to remind everybody that you can go ahead and submit questions to Pete or myself in that question section of your GoToWebinar control panel. I see a couple coming in, and we'll get to those in just a moment. Before we do, I want to remind everybody that NeedyMeds is also here as another source of support. As you can hopefully see, NeedyMeds and RX Outreach, our missions clearly align. Our goal is to connect people with the medications they need, but the key is to do that quickly, easily, and without obstacles. So I will mirror what Pete said, which is that I encourage you to visit the NeedyMeds website. I do hope you join us for an overview webinar to learn more about NeedyMeds. But as Pete said about RX Outreach, look at the website, but give them a call. And I'm going to say the same exact thing about NeedyMeds. If you have any questions about what we do, how we do it, or you're looking for help affording a specific medication or a healthcare expense, reach out to our call center expert counselors. And that phone number is 1-800-503-6897. And of course, that will be up on your screen at the end of this. In the meantime, what you're looking at on your screen now, I'm just going to pull up some of our most popular and effective ways to save on your healthcare expenses. I'm not going to take the time to go over these now. I just want to give you a sense of the breadth of resources that we offer. The last one I'm putting up is we do offer a drug discount card. Pete referred to that in his presentation, and one of the questions coming through is about the NeedyMeds drug discount card. Although NeedyMeds was founded more than 2 decades ago, we did not implement a drug discount card of April in 2009. And although there are other discount cards out there to help you get your meds, the NeedyMeds drug discount card is different because not only is it free and anonymous, which is a big deal, but we actually hope you never have to use it. Our goal, we just put it in there in April 2009 because our president and founder, Dr. Rich Sagel, said, what if people turn to NeedyMeds and we can't help them, or a partnering organization can't help them? We can't turn them away with nothing. So as a safety net, we provide our own NeedyMeds drug discount card. Anybody can use it. There's no registration, no activation, no enrollment. You do not have to be documented. You do not have to prove insurance status. The only rule is it can't be combined with insurance. If you want to learn more about our drug discount card, you can visit our website. On the left-hand side, you'll see a big red arrow that says Get Your Drug Discount Card. You can learn more about it there, and you can also print one out or ask us to mail you one. As the questions come in, I'm going to put up the contact information for Pete and his colleagues, Erica and Susan, as well as the website, and as promised, a toll-free helpline to NeedyMeds on the bottom right of that screen. So Pete, one of the questions coming in that comes in, I think, pretty regularly is if you would review how much does RX outreach cost, both to the patient and to the provider?
Okay. Yes, it does happen often. From both perspectives, if you are a provider that provides, that pays for the scripts for patients, or if you are the patient that pays for your own scripts, the only cost to you is the cost of the medicine. So if you're on site, if you're online, or if you have one of our brochures and you pick a $20 medication, that is the only cost you are obligated to pay. There actually are no other, we ask you for no other payments of any kind. We don't even have any services that are fee-based services. So the only thing that you pay is for the cost of the medicine you see.
Thank you so much for clarifying that, and thanks to our audience member for asking, because that's something that's always asked for Pete to clarify. Here's a pretty specific question. Does RX Outreach have inhalers?
Inhalers, we do. Yes, we have. You know what? I can't even remember the name, but yes, we do. If you go online and you look in the, I believe it's the allergy section, you will see that we have inhalers.
Thanks so much, Pete. And I do see some other questions coming in about specific medications, such as whether or not RX Outreach offers medications for diabetics.
We have a diabetic formulary that's fairly robust. So again, I refer them to their, I apologize for not being a pharmacist educated in the pronunciation and knowledge of all the medications in our formulary, but the diabetic support formulary is very robust. It's a significant part of our profile. So yes, there are diabetic medicines. There is not an insulin. I get very self-conscious about saying no to this question, and we're on our way to resolving it. But based on our shipping model and the patients we serve, there are some issues. One, insulin needs to be cold shipped, which adds cost to it. But the other part of it is right now we are licensed and set up to ship 90-day supplies of medicine, and our patients, being as gracious and humble as they are, they will share it with someone they go to church with, one of their neighbors, um, in being neighborly. And when it comes time for them to use it, then they don't have it, and then they will end up without insulin and with all the reactions and possibly in the emergency room. So in all of our models, we can't find our way around that. So we are looking to shift things around in 2019 and be able to answer that affirmatively when asked next year.
Thank you so much, Pete. And as I said, I do see a number of questions coming in about specific medications. So I'm going to make a blanket statement for both RX Outreach and NeedyMeds, not because Pete and I don't want to answer the question, but it would probably be easier to contact an expert call counselor directly, simply because of not only the updated knowledge that they have, but also because they'll be able to walk you through the steps, and that you would find that more helpful. And again, we encourage you to reach out to RX Outreach directly or NeedyMeds.
Yeah, and I'll add on to that, Carla. Again, going to the nonprofit focused mission that we have to serve low-income patients through, free and charitable clinics and those kind of outlets. More than 60% of our formulary that you see when you go online is there because our providers asked for it. So if you have specific medication questions, and you have a sustained need that we might be able to replicate and expand, and while it's not as easy as we'll go buy it, that's how our formulary grows, because we're not, as a nonprofit, we're not here to bulk store medications that no one uses. We're here to bulk store medications that people have asked us to carry that we can help them save cost on. So again, if you've got a medication that you don't see in our formulary, shoot us a note. Let us explore the sustainability and the viability of carrying that. And we will start working through our contracts to see about providing it. So we invite you to.
Thank you, Pete. And I would encourage you being our users and our audience, to also be vocal about your experience at NeedyMeds. We can't offer you the most assistance if we don't know what you're looking for. So please be vocal about what you need and how you're finding things through our website or through our toll-free helpline. One of the questions that's coming in now, Pete, and I think we get this with most of RX Outreach presentations, is what kind of income documentation is required?
None. We are a self-attested program. We don't carry opioids. We carry few controls. So at the behest of expediency and service to a population that doesn't get great service, if you tell us you're below 300%, we accept that. It kind of becomes a moral issue if you want to lie about getting amlodipine or something that it's not worth it. So if we will ask you what your income is, you will tell us what your income is, and we will move on with our process. So we do not require paycheck stubs or income tax or any of that.
Great. And thank you to our audience member for asking that, because as I had said, that is another frequent question we get for the RX Outreach presentations. And a couple of other questions coming in that are actually for NeedyMeds. And if everybody will bear with me just a moment, I'm going to take a moment to escape out of the PowerPoint presentation and onto the NeedyMeds website to answer two questions that came in. One is, Pete talked about the federal poverty level guidelines, or FPL, and you can find a handy federal poverty level guideline calculator under the patient savings tab. You see my mouse is hovering over that patient savings tab, and a whole bunch of categories pop up. Under the government programs section on the bottom right-hand side, you will see a link to the federal poverty guidelines for 2018. So that's really helpful. The other thing I wanted to point out is under the patient savings tab. On the left-hand side, you'll find assistance for medications. But in the middle, under that patient savings tab, you'll also find a section for diagnosis-based assistance programs. This is a database that is specifically for health expenses that don't fall neatly under the category of medications. For example, we just had an audience member ask if either one of our organizations offers assistance for something like testing supplies. You can find that type of assistance by looking up under the diagnosis-based assistance database. And again, don't feel you need to be an expert in the NeedyMeds website. We are very proud of the breadth of resources we offer, but it can certainly be a bit overwhelming. We're the first to admit to that. So please don't hesitate, again, if I haven't said it enough, to reach out to our expert call center counselors. Don't forget, we are in Massachusetts on the East Coast. So with that, I'm going to go ahead and wrap up today's presentation. A reminder that if we didn't get the chance to answer your specific question, we will follow up via email either later today or by tomorrow. But if you don't have a chance, if you feel that your question is more urgent, there's the contact information for both of our organizations. Thanks so much to our audience for taking time out of their day to learn about RX Outreach, about NeedyMeds, and thank you, Pete, for sharing your expertise with the NeedyMeds users. Thanks, everybody, and have a great rest of the day.